not a very happy warning, but it looks as though we do. We have to get systems in place to be with this. That means testing, it means screening, it means creating COVID-free zones in our hospitals, cancer centers, for example, in my specialty. So we are going to have to get used to it. How we deal with international travel, which particularly concerns you down there, is going to be very difficult, and it is going to be challenging. And we're going to have international standardization on quarantine, on testing, on rules and so on, temperature checking. It'll all be part of airports for the next 12 months, maybe even longer.
And do you think we're going to have to almost get a standardized tolerance as to how many cases would be floating around at any one time?
That's right. And at the moment, we don't have that information because testing, certainly in the UK, has been very badly organized. And we just haven't got the numbers of tests to understand where the virus is in society. If you could only see the virus, people would just light up if they had it on their body, it would make life a lot easier. But it's not like that. The tests are imperfect, both the virus tests and the antibody tests. They're not perfect, but they're all we've got. And we've got to use them in the most effective way possible.
Let's come to your specialty, of course, the area of cancer. Why has treatment been and diagnosis of patients been so disrupted?
So all health systems all around the world have focused on COVID for the last 6 weeks now. So the peak came in the UK about Easter, and before that, all operations had stopped. So you couldn't get a diagnostic scan, you couldn't get an endoscopy when a tube's put into your stomach or into the colon. You just couldn't get it done, which meant that the biopsy rate for cancer, snipping a little piece of cancer out and sending it to the lab, the biopsy fell precipitously. So in the UK, last month, April, 30,000 people should have been diagnosed with cancer. Instead, it was something like 5,000. That means it's not that 25,000 people have been spared with cancer. They've got cancer, all right. They've just not been diagnosed, and they'll come later in the year. As we heard one of your physicians just say, they'll come in a peak. The cancer patients, the diabetic patients, the asthma patients, they'll all come together in the summer, or hopefully in the summer, because otherwise the delay could be even greater to the autumn. And they'll stress all healthcare systems all around the world.
Let's talk about that delay. If it's 6 weeks, if it's up to 3 months, the delay of getting those biopsies and those tests, as you point out, what does that mean to the progress of a cancer?
Well, we know cancer goes in stages. So whatever cancer it is, there are good systems to stage. So stage 1's early cancer, stage 4 is late spreading cancer. It's likely that a lot of stage 1 cancers all over the body will spread to become 2 or 3, which means the outcome is much poorer. Not only that, the treatment is more complex, it's more expensive, it requires more chemotherapy, more radiotherapy, more complex treatment, even more complex surgery. So the 3 treatments for cancer will be more difficult to implement. So there will be a problem. The quicker we can get over it, the better. So if we can deal with it in the next 3 or 4 weeks, fantastic. It won't be a big problem. The outlook will be roughly the same, maybe just very slightly poorer. But if it goes on for 6 months, we could be looking at 50 or 60,000 deaths in the UK just from cancer. And that's double what we've seen here from COVID, where it's running at about 34,000 deaths at the moment.
And when you look at the health system, say like in the UK, which has had a very difficult time with COVID, how likely is it that this health system is going to spring back quickly to normality?
It's not. That's the problem. Our system works at capacity normally. So we have waiting lists, we have rationing, we have deflection of patients around the system. You know, the lucky 15% can pay and go privately and they can get dealt with quickly. So a system that has spare capacity, such as many European systems and a little bit the Australian system, they can deal much more better with the battering this pandemic given us. We're going to be slow to recover. And then there's the politics. You know, medical politics are the worst areas for politics. People are going to complain. People feel a bit embittered with the politicians about the PPE issue over here and the lack of testing and the lack of organization. and just the whole bureaucracy that we have within a state-run, exclusively state-run system. So I think there will be change, and we've got to get out of this together somehow. Everybody's got common problems. We share a lot with you guys down south, but there's also individual country problems depending on the system and the peculiarities of this pandemic.
What advice do you have for people at the moment? It does differ, of course. Australia, the health system is not as under pressure as much as the UK. What should they be doing right now?
Don't be put off. That's my main advice to people that have cancer-like symptoms. If they're worried about some, don't be put off. If you can't get an appointment tomorrow, take one next week. If you're offered a phone appointment or a Skype appointment, just take it. Just make sure you go. A lot of, especially older people, are frightened to go to their general practitioner. Don't be frightened. Just keep moving. Ask and get through the system. It's like in a plane crash. Plane lands at an airport and there's a hole in the side. Everyone's told to sit still. The guys that survive are the ones that go through the hole. Yes, you have to be through that hole.
Yes, you have to push through. And I know too that some people are very concerned about being treated for cancer during this period because it does impact the patient's immune system. Regardless, I guess your advice would be to push forward with cancer treatment if you need it.
Ask your oncologist or specialist nurse. There's no doubt pushing forward is almost certainly the best way. The risks of untreated cancer or poorly treated cancer far outweigh the risk of getting an infection, which even with corona, most people are not affected very seriously, thank goodness.
Karol, as always, appreciate your expertise. Thank you.